Dr. Christie again. Welcome back with secret or truth number 2. We just talked about the brain and the central nervous system and how it controls everything. Well, secret and truth number 2, this might also seem obvious, but any interruptions to that system will start to cause symptoms or effects. So when the brain cannot do the best it can with what it has, and what it has is poor, and the communication is poor, what we're looking at is not just a system in the body. We're not looking at, maybe the behavior in your kid and why they can't sit and focus, or they have emotional meltdowns, or they have a hard time transitioning, if they're, unable to focus and listen in school, or they're causing disruptions. We're not just looking at that. We're looking at why that's occurring. We're looking at what kind of signals are reaching the brain, what kind of input is it getting, that the output you're seeing and the behavior that you're seeing is something that's undesirable. And that goes along with any other output that we see with any organ system. So a lot of these children tend to have other issues going on. We call them comorbidities. There might be something like asthma, allergies, there might be some GI issues, or some other immune struggles is what we will typically start to see, maybe even endocrine, hormonal dysfunctions. But the reason why we start to have those is because the brain's not getting the right input. It can't get partial information, try to organize and do the best it can with what it has, figure something out, and send the signals back through. Well, those are still going to be partial and unorganized. So we want to know, how organized is the brain? How well is it able to adapt to different stressors in your life? So interruptions to that cycle are what we're going to look at, what we're going to talk about in that webinar. Stay tuned for truth number 3.